1. Which of the following best describes the principle of andragogy in adult learning? A. Adults learn best when provided with passive lecture-based content. B. Adults prefer learning that is self-directed and relevant to real-life tasks. C. Adults rely primarily on rote memorization to retain knowledge. D. Adults require more repetition and reinforcement than children. 2. When designing a curriculum for adult critical care nurses, what should be prioritized first? A. Selecting the latest textbooks and journals. B. Identifying learner needs and practice gaps. C. Creating detailed PowerPoint presentations. D. Choosing a convenient time for class delivery. 3. A nurse educator is developing an outcome-based curriculum. Which element must be clearly defined? A. Learner attendance requirements. B. Specific, measurable learning objectives. C. Instructor's preferred teaching style. D. Organizational mission statement. 4. Which evaluation method is most appropriate for assessing psychomotor skill competence in a critical care course? A. Multiple choice written exam. B. Direct observation with a skills checklist. C. Anonymous learner feedback survey. D. Open-ended reflective essay. 5. A key advantage of simulation-based training for adult learners is: it eliminates the need for clinical preceptorship. It allows safe practice of high-risk scenarios without harming patients. C. It requires fewer resources than traditional classroom teaching. D. It guarantees perfect skill retention after one session. 6. Which communication technique is most effective when giving constructive feedback to a mentee? A. Use vague language to avoid hurting feelings. Provide feedback only at the annual review. C. Use specific, timely, and behavior-focused language. D. Focus solely on what went wrong. 7. The principle of formative evaluation emphasizes: A. Final outcomes and summative scores. E. Continuous feedback to guide learning improvement. C. Comparing learners' results to national benchmarks. D. Accreditation requirements. 8. When aligning curriculum objectives with Bloom's taxonomy, analyze falls under which domain level? A. Knowledge. B. Comprehension. C. Analysis. D. Application. 9. Which of the following is a regulatory requirement for continuing education programs in many U.S. states? A. Inclusion of a pre-course survey of learner hobbies. B. Submission of a learning needs assessment to the state board. C. Provision of measurable objectives and proof of attendance. D. Posting curriculum materials on a public website. 10. During a mentoring session, the mentor notices the mentee is reluctant to participate. The most professional response would be: A. End the session early and reschedule. B. Use open-ended questions to explore barriers and concerns. C. Deliver a lecture on the importance of participation. D. Document the mentee's lack of motivation. 11. When developing a continuing education activity, which step ensures compliance with accrediting body standards? A. Selecting only institution-preferred faculty. B. Ensuring content is free from commercial bias. Including as much promotional material as possible. D. Skipping disclosure of financial relationships. 12. The most effective way to evaluate a new curriculum's long-term impact on patient outcomes is: A. Administer a post-test immediately after the session. B. Collect learner satisfaction surveys only. C. Conduct longitudinal tracking of key clinical indicators. D. Observe class participation levels. 13. Which instructional strategy best supports different learning styles in adult learners? A. Provide identical lecture slides for all learners. B. Combine visual, auditory, and kinesthetic methods. C. Limit teaching to only verbal explanation. D. Avoid using technology to reduce distraction. 14. A critical care educator wants to promote higher-order thinking skills. Which activity is best? A. Asking learners to recall definitions. B. Assigning a reading comprehension quiz. C. Presenting a case study requiring problem solving. D. Showing a recorded lecture. 15. What is the primary purpose of gap analysis in curriculum development? A. Determine budget allocation for educational materials. B. Identify differences between current and desired learner competencies. C. Rank faculty members by teaching effectiveness. D. Evaluate the popularity of previous training topics. 16. According to adult learning theory, which factor most influences engagement? A. Learners' prior experience and relevance to current roles. B. Length of instructional slides. C. Availability of free food at the session. D. Instructor's professional title. 17. A summative evaluation is most useful for A. Monitoring learner progress during instruction. B. Providing real-time coaching. C. Determining whether course objectives were met after completion. D. Identifying learning styles before instruction. 18. Which method promotes reflective practice among adult learners? A. Multiple choice quiz. B. Structured debriefing after simulation. C. Group icebreaker activity. D. Memorization drills. 19. The most critical factor to ensure communication clarity in high-stakes critical care situations is A. Using medical jargon to sound professional. B. Employing closed-loop communication. C. Waiting until the end of shift to relay updates. D. Relying solely on written notes. 20. Which mentoring approach best facilitates professional growth? A. Mentor provides all solutions to the mentee's problems. B. Mentor encourages mentees' self-directed problem solving. C. Mentor limits interaction to once per quarter. D. Mentor focuses exclusively on technical skills. 21. Which of the following is an example of criterion-referenced evaluation? A. Comparing learner performance to national averages. B. Measuring learner achievement against predetermined standards. C. Ranking learners from highest to lowest score. D. Evaluating learners using peer-to-peer comparison. 22. Which regulatory element is essential to include in continuing education documentation? A. Learners' personal opinions on instructors. B. Post-course party attendance. C. Verification of contact hours awarded. D. Instructor's favorite teaching method. 23. To encourage critical thinking, which questioning technique should an educator use? Yes or no questions. B. Leading questions that reveal the answer. C. Open-ended Socratic questioning. D. Rapid-fire factual recall questions. 24. Which strategy is most effective for addressing diverse cultural backgrounds in adult education? A. Standardizing content without acknowledging diversity. B. Encouraging inclusive discussion and respecting varied perspectives. C. Avoiding culturally sensitive topics altogether. Delivering identical examples regardless of learner context. 25. A nurse educator is creating a mentorship program. What is the first step? A. Establish clear goals and expectations for both mentor and mentee. B. Assign random mentor-mentee pairs. C. Wait for mentees to define the entire program. D. Schedule a single introductory session. 26. Which element strengthens a course evaluation form? A. Exclusive focus on learner satisfaction. E. Inclusion of both qualitative and quantitative feedback items. C. Use of only open text responses. D. Asking about irrelevant topics like parking availability. 27. Which action ensures compliance with HIPAA regulations during case-based teaching? A. Use real patient identifiers to enhance realism. B. Remove or de-identify all patient-specific data. C. Share case details on social media for learner review. D. Ask learners to guess patient names. 28. When implementing a flipped classroom model, what should learners receive before class? A. Final exam questions. B. Pre-recorded content and preparatory materials. C. Random discussion topics with no context. D. Peer performance evaluations. 29. Which type of assessment measures higher levels of Bloom's taxonomy, such as synthesis and evaluation? A. True-false test. B. Multiple choice recall quiz. C. Open-ended case analysis. D. Matching exercise. 30. Which communication tool is recommended for structured handoffs in critical care? A. SPAR, situation, background, assessment, recommendation. B. Freeform narrative storytelling. C. Unstructured group discussion. D. Written notes only. 31. A nurse educator notices learners are disengaged during a lecture. Which approach best re-engages them? A. Continue lecturing without adjustment. B. Pause and incorporate interactive questioning or group work. C. Shorten the lecture by skipping content. D. Administer a surprise quiz immediately.